we think of diabetic kidney disease, diabetic nephropathy, as being a fairly characteristic set of pathologic changes that go on with a decline in kidney function. Now that's not to say that everyone with diabetes who has kidney problems gets those set of changes. In fact, many folks with type 2 diabetes will have other types of kidney disease as well as their nephropathy, diabetic nephropathy. So just because you have that doesn't mean you can't get something else going on in your kidneys, and there often will be a mixed pattern in folks that are older, such as our type 2 patients. But yeah, there seems to be a single type of disease that occurs in folks with both type 1 and type 2 diabetes that really is characteristic of what we call diabetic kidney disease. Well, I think the main points were, first of all, to talk about what a huge problem diabetic kidney disease is in the United States and around the world, largely due to the growth of type 2 diabetes and the fact that about 30% or more of patients with type 2 diabetes will eventually get kidney disease, and a good portion of them will progress to what we call end-stage kidney disease or kidney failure. So there are a lot of factors that go into it. Clearly, high glucose is a major regulator of what goes on in the kidneys. It turns on a lot of processes. First of all, it makes the blood pressure in the glomeruli, the filtering units of the kidneys, much higher. Just by having high glucose changes the blood flow. But then over time, it has a number of effects, including increasing what we call oxidative stress and increasing inflammation in the filtering units and in the rest of the kidneys to cause ultimately scarring, fibrosis, and loss of. Interestingly, there are very few symptoms or even clinical signs other than what you measure in laboratory testing, and so usually it's picked up based on something that you can see in the urine, protein in the urine, or you can see a blood test that indicates reduced ability to filter things out of the bloodstream, so increased kidney failure, decreased kidney function. Interestingly, it manifests itself most troublingly by an increased risk of cardiovascular disease. So kidney disease itself leads to cardiovascular endpoints, independent of all the other risk factors. And in fact, if you look at the data, kidney disease is the major cause of increased mortality in folks with diabetes. So if you don't have any level of kidney disease whatsoever, your mortality as a diabetic patient is a little worse than the general population, but not a lot. If you add kidney disease in the mix, and particularly more severe kidney disease, then you have a tenfold increase. So it's a major impact. General practitioners and diabetic practitioners really need to know about this because it's as I told you before, it's a hidden disease, and so if you're not screening for it in all your diabetic patients, then people can progress a long time before they get the treatment that we know is at least helpful now, and so everybody should be getting good tight blood sugar control anyway. To do that to help prevent kidney disease is very important. Good, excellent blood pressure control, use of ACE inhibitors, all these things need to happen at an early point in the disease, and so patients need to be screened by their primary care docs. They need to be screened, as they generally are, by diabetes specialists. But it doesn't happen as much out there, and interestingly, there's a lot of unawareness among patients as well as practitioners. So even folks that have over 50% reduction in their kidney function, only about 40% of those patients know that they have kidney problems. So there's a lot of information, a lot of education, and dissemination of what we know now is effective that's required just to get us up to where we should be right now.